our ultrasound machine that we use in the emergency department is a cart-based device where we use it basically at the patient's bedside as a point of care diagnostic tool and therapeutic tool. And what that means is we're using it as an extension of our stethoscope to be able to diagnose patients who come in with certain injuries or medical conditions. And if they have certain medical conditions that requires intervention, like drainage of fluid from their belly because it's causing them to be distended, it's causing them discomfort or to be short of breath, then we do that for therapeutic reasons. So for example, a really good utilization of a bedside ultrasound is if you have patients who come in after a motor vehicle accident and they come in with chest pain or they come in with belly pain, and you're worried that there's internal injuries or internal hemorrhage, meaning they're bleeding inside their belly or their chest. Before, we would be able to use, all we had was basically the stethoscope as a quick, immediate data point to be able to recognize, is there internal hemorrhage inside their belly or inside their chest, prior to sending them to the CAT scanner. But now with the bedside ultrasound, we can actually put the probe where we apply a little bit of jelly onto the probe, and then we put it on their abdomen or their chest to see if they have internal bleeding inside their belly and their chest. And so it gives us very quick data points to collaborate with our surgical trauma team to see if the patient needs to go to the operating room, especially if they're critically unstable. The fact that we can use it on the hour to diagnose our patients, to use it as an intervention for therapeutic procedures has been a big relief to our staff. So from a cognitive workload and just even workflow within the emergency department, it helps to expedite care for our staff and our patients. And it helps us to safely manage our patients, whether they need to be held overnight in the emergency department for a radiology ultrasound in the morning, or we can safely send them home and bring them back for an outpatient follow-up with further imaging, whether that be with radiology ultrasound or with a CAT scan or other diagnostic modalities, or follow up with a consultant as needed. On behalf of the HSC Emergency Department and our staff, we are truly grateful for their vision and their generosity and their kindness in helping to support our frontline colleagues in more ways than just providing us with the PX machine. They have been generous in terms of our well-being. They have helped us with regards to during the first wave of the pandemic to be able to help fund us with, they offered to help us with scrubs. They offered to help us with rooms at Canada Inn so that we could actually have a safe place to shower and sterilize ourselves when we go back home to our families. They have helped us with solidarity meals for our frontline staff. And now we are so blessed to have had these two beautiful ultrasound machines to be able to improve our patient care. And so from the bottom of our hearts, thank you for their generosity and their kindness and for their solidarity of community.